8 years old man complains of pain and weakness. It is the pain and weakness in his shoulder. He has recently been unwell with glandular fever, which is a viral fever, from which he is fully recovered. On examination, there is some evidence of muscle wasting and degree of winging of the scapula. Power during active movement is impaired. What is the most likely diagnosis? So here we can see there is definitively nervous system involvement, because there is a muscle wasting and there is a winging of the scapula, and also there is power during the active movement is impaired. That means there is the impairment or compromise of the nervous system. What is the answer option? Here the option: Parsonage-Turner syndrome, adhesive capsulitis, rotator cuff tear, osteoarthritis, calcific tendinitis. So first of all, let's see the Parsonage-Turner syndrome or the brachial plexitis. It is acute onset of intense pain of the arm and shoulder region, and with it is the weakness and atrophy of it developing simultaneously, generally within the 2 weeks, as pain lesion. It is in 34% cases it is the bilateral, commonly preceded by upper airway infection or vaccination. That means in case of the Parsonage-Turner syndrome, there is a history of viral infection in the body. And EMG helps diagnosis as a plexus lesion. Recovery occurs 36% as 1 year and 89% within 3 years. So its recovery is spontaneous. And better prognosis for upper trunk lesion. No specific findings in the MRI, but atrophy can be pronounced. Now see another slide here. The Parsonage-Turner syndrome, it is acute brachial neuritis, the sudden onset shoulder pain or arm pain, and it is followed by the motor and sensory deficit. So first of all, there is a history of the viral infection. Second of all, sudden acute onset shoulder pain, and then third of all, there is motor and sensory deficit. So the first event is the viral infection. What is the second option? The second option is the shoulder pain or arm pain which is suddenly developed, and the third one is the nervous system involvement or nervous system deficit. And its cause is unknown, but is related to the viral infection. That means there is a usual history of the viral infection, and 90% of this recovered within the 3 years. So here the Parsonage-Turner syndrome, what is it? It is a peripheral neuropathy, and this peripheral neuropathy developed following a viral illness. So we have to keep in mind that is there any viral illness and is there any nervous system involvement? Is there any history of the viral infection? And also there is a history in clinical examination, there is peripheral nervous system involvement. That means the sensory and motor action deficit. In this condition, diagnosis goes to the Parsonage-Turner syndrome, and it recovers spontaneously. That means we have to wait and watch up to 3 years in some patient. So what is the answer? The answer is the Parsonage-Turner syndrome, because the Parsonage-Turner syndrome, first of all, there is a history of the glandular fever, that means that viral infection, and also there is a pain and weakness of the shoulder or arm, and the muscle wasting, evidence of muscle wasting and degree of winging of the scapula, and also the power movement is impaired. So it is definitive that it is the nervous system involvement. So our answer is the Parsonage-Turner syndrome.